Okay, so let's dive into this. If you're an athlete, you're probably used to understanding how your body works, right? You track metrics, you know what a PT session feels like, you know what to expect from a deep tissue massage. But acupuncture? For a lot of people, it's a total black box. And that uncertainty, that can be a huge reason why people hesitate to even try it.
So let's just get right to the elephant in the room, shall we? The needles. The number one question is always, is it gonna hurt? What's it even supposed to feel like? And are you just, randomly sticking pins in me? These are the exact questions that can keep someone from trying what could seriously be a game changer for their recovery and performance.
And hey, if you're feeling that anxiety, you are definitely not alone. So the whole point of this explainer is to just pull back the curtain. We're going to give you a clear step-by-step roadmap of a first session from the minute you walk in the door to the minute you leave, and I think you'll see it's a much more logical and honestly relaxing process than you might imagine.
First things first, and this is absolutely crucial. Your session starts with a conversation, not with needles. The very first priority is for us to understand you, your body, and what you're trying to achieve. This is not a one-size-fits-all kind of deal. That first 15, maybe 20 minutes is all about you. We're going to talk about the specifics of your condition, what your performance goals are, whether that's hitting a new PR or just being able to run without pain. We'll even talk about how this whole thing is affecting your daily life. And most importantly, it's your chance to ask anything. No question is off the table.
So how does this all actually work? Well, when you boil it down, the explanation is pretty simple. Think of it like this. The needles are just sending these tiny little signals to your brain, basically reminding your body how to heal itself. We're just giving it a little nudge, prompting it to release that tight muscle, wake up a weak one, and get the blood flowing. It's really just a retraining process. Okay, so after we chat, then comes the physical assessment. And this is some real detective work. It's super methodical. We start with a visual scan, just looking at your posture, how your hips are aligned, if one shoulder is higher than the other. Then we move into functional tests to see a range of motion, see which muscles are actually firing. After that comes palpation, which is just using touch to find those tight spots and trigger points. And finally, we might check out some Eastern diagnostics, like looking at the tongue and feeling the pulse to get an even deeper picture.
And this is where it all comes together in a really cool way. Think of it like a bridge. The Western-style orthopedic tests tell us what is wrong. For example, your VMO, that teardrop muscle in your quad, isn't firing properly. The Eastern assessment helps us understand why it's not firing. It might point to an imbalance in what we call the spleen channel. So one tells us the symptom and the other points us toward the root cause.
All right, now for the part everyone's been waiting for, the treatment itself. This part is built directly on everything we just learned in the assessment. And the two most important words here are interactive and comfortable. You are absolutely an active part of this process.
So here's the deal, and this is non-negotiable. The entire experience has to be in your comfort zone. If you're nervous, maybe we just start with a few needles. If you're totally fine, we might do more. This is not a toughness test. The whole goal is to create a therapeutic response. And that just can't happen if your body is tense and anxious. We meet you where you are.
So what are you supposed to feel? Well, most of the typical sensations are actually signs that it's working. You might feel a little tingling, maybe some warmth spreading, or a sense of heaviness right at the needle site. Sometimes there's this dull, achy feeling. That's what's often described as the chi moving. All of these are totally normal, therapeutic, and exactly what we're looking for.
But what if you feel something sharp? Okay, here's the rule. If you feel anything sharp that lasts for more than, say, 3 seconds, you just say the word. That's it. We take it out immediately, and that feeling is gone, instantly. Usually it just means we bumped a tiny hair follicle on the way in. The big takeaway here is that you are always, always in control.
Now there's one sensation that surprises just about everyone, the muscle twitch. You might flinch a little bit. It happens to everyone. But that twitch, oh, that is a fantastic sign. It's like physical confirmation that a super tight muscle is letting go, a weak muscle is finally waking up, or a stubborn trigger point is releasing its grip. It means we hit the jackpot. We're in exactly the right spot.
Okay, so once all the needles are placed and you're feeling comfortable, we move into what many people say is the absolute best part of the whole session. This is where your body really gets to work.
Now check out this statistic, because it really blows people's minds. 2 out of every 3 people fall asleep during their very first acupuncture session. Just think about that for a second. People who walked in the door anxious about needles are so relaxed just a few minutes later that they literally drift off. This blissful state of rest actually has a name. We call it the Acu-Nap. It's that moment when your nervous system finally shifts out of that stressed-out fight-or-flight mode and into the rest and digest state. This is the exact same mode your body uses for deep healing when you sleep at night. It's basically like hitting a reset button for your entire system.
And the whole environment is designed to help you get there. You're in a private room, the table might be heated, maybe there's a nice warm heat lamp, and the lights are dimmed. Plus, you have a call button right there next to you. So you can completely let go, knowing you're safe, you're comfortable, and you're in control.
So the session's over, the needles are out, you're feeling all relaxed and floaty. What's next? What should you expect in the hours and even days after your treatment?
Well, it's really common to feel a little bit sore. You know that delayed onset muscle soreness or DOMS you get after a really good workout? It feels a lot like that. And that's a good sign. It means we actually made changes. You'll also probably have an incredible night's sleep and might feel kind of relaxed or floaty. And yeah, a small bruise can happen sometimes, but it's not super common.
And here's a little pro tip just for athletes. If you can, try to schedule your workout for before your acupuncture session. That way you can go home, hydrate, and just let your body kind of marinate in all that healing. It lets your system really integrate all the changes without immediately putting it back under stress.
So after going through this whole process, from the initial conversation all the way to that blissful Acu-Nap, what's the big realization? What's the one thing that truly surprises people who walked in feeling a bit anxious?
Overwhelmingly, it almost always comes down to these three things. First, just how little the needles are actually felt. It's nothing like the sharp pain people imagine. Second, the sheer depth of relaxation they experience, that Acu-Nap is a real shock to the system, in a good way. And finally, how a 20 or 30-minute rest can feel like it flew by in 5 minutes.
So let's bring it all home. After walking through every single step, what's the one crucial point that you should really take away from all this?
It's this. The reality of a modern, sports-focused acupuncture session is a completely different world from that scary or mystical image a lot of us have in our minds. It's a calm, it's comfortable, and it's a highly logical process that's all about communicating with your body in a language it already understands. The biggest barrier isn't the experience itself, it's just the fear of the unknown.